Thank you. At the outset, I'd like to thank AIOS for the opportunity to present our work. We all know that keratoconus is a bilateral but asymmetric disease. And a lot of times we see that only a few eyes progress and not all of them progress. Even in the same individual, one eye can remain stable and the other eye keeps progressing. This is often seen, but the cause is still unknown. So we ask the question, why do some eyes progress while others remain stable? And the purpose of this study was to analyze the biomicroscopic changes in progressive keratoconus and correlate with biomarker changes to understand pathophysiology of progression better. So we included patients more than 18 years of age with bilateral keratoconus who had a unilateral progression on follow-up visits. And we excluded patients who had previous ocular surgeries, allergic conjunctivitis or vernal keratoconjunctivitis, or patients on topical medications, patients who were using contact lenses, and patients with hormonal disorders or any hormonal therapy. The sample size was calculated to be 15 in each group, and we included both eyes of the same individual to make sure that the risk factors were similar. So in the same individual, one eye was stable, other eye was progressive. 20 patients with 20 stable eyes and 20 progressive eyes consequently were included. And all patients underwent slit lamp evaluation, corneal topography, confocal microscopy, and tear sample collection on baseline as well as the follow-up visits. Confocal microscopic image was analyzed using automated CC metrics software, which analyzed the image and annotated it to calculate the nerve branches, branching points, and the main nerve fiber, and gave the parameters automatically. Tear sample analysis was done by collecting the tears with Schirmer strips and storing them in Eppendorf tube at -80 until it was seen which eye was stable and which eye progressed. Further, they underwent BCA analysis and ELISA was done to calculate the biomarkers. So coming to the results, on confocal biomicroscopy, we saw that there were significant changes at baseline between the stable eyes and the progressive eyes in nerve fiber density, nerve branch density, nerve fiber length, and the total branch density. These are the representative image of a stable eye and a progressive eye. We did not see any difference in the keratocyte density in the anterior stroma, middle stroma, or the posterior stroma. On follow-up visits in stable eyes, we saw that there was no significant difference between the baseline visit and the follow-up visit in stable eye. But in a progressive eye, we saw that the nerve fiber density, nerve fiber length, and the total branch density continued to reduce significantly. Then we further performed a correlation analysis between the tear biomarkers which we had seen with these confocal features that we were seeing between the two eyes. And we saw that there was a strong correlation between the SBNP features with interleukin 2, 21 and CCL2. To simplify the previous slide, the correlation analysis showed that the interleukin 2 and interleukin 21 had a significant difference in progressive keratoconus with CTBD, but this was not seen in the stable eyes. Similarly, CCL2 was significantly different in the progressive eyes when it came to correlation with nerve fiber density, total branch density, and nerve fiber length, but this was again not seen in the stable eyes. So we saw that there was a significant difference in the nerve parameters and tear cytokines in progressive eyes as compared to the stable ones. So we already know that there is a confocal microscopic change which is seen in normal eyes as compared to keratoconic eyes in terms of subbasal nerve plexus features. And we have also seen that some inflammatory biomarkers have been identified which are seen in keratoconic eyes as compared to eyes which are normal. So we know that inflammatory cytokines are increased in keratoconus as compared to controls. But in this particular study, we looked at the biomicroscopic changes and combined them with biomarker changes in keratoconus where one eye is stable and the other eye is progressive. And we came up with specific biomarkers which were seen only in progressive eyes and not in stable eyes. So what we already know is that keratoconus is bilateral and asymmetric, but not all eyes progress at the same rate. Confocal microscopic changes in nerves and keratocytes have been described in keratoconus as compared to normal eyes. But what our study adds is that there is a significant difference in the nerve parameters in stable versus progressive eyes in keratoconus, not seen in keratocyte density. And interleukin 2, 21 and CCL2 have a role to play in these structural changes and could be targeted in future to arrest progression. Thank you.
So, like after analyzing this study, how we are going to help our patients? How would we, the eye which is progressing, or at times if we are seeing a patient where one eye is progressing and other eye is not so progressing,
because
how would it change our management?
That is what we have seen, that we've identified the markers now. Now we will have to find a treatment to target these markers, isn't it?
So you are concluding that these were the markers which were raised in the affected eye or the eye which was showing the progression.
And it is causing structural changes as well. So that is why we have done a correlation. That not just that the markers are increasing, but it is also causing a structural change which can be identified on confocal biomicroscopy, which is showing that there is a difference between the two eyes. Because the individual is same and the rest of the risk factors are going to be the same.
But they had been on some sort of any immunomodulatory, some steroids or anything?
No, we've excluded
Not
all
really.
of that. That was the exclusion criteria that I had shown.
Okay.
Thank you.
Thank you.